So it's important to try ask government, if we can, what ways through which we're going to have some kind of sustainable solution to a vaccination drive that's moving fast enough.
Yes, and to hear more about that, let's speak to Dr. Nicholas Crisp, who is the Deputy Director General in the Department of Health, who heads up our vaccination rollout in the country, and he's going to help us explain how the Health Department will make vaccinations easier. Dr. Crisp, thanks very much for joining us this morning. Can you tell us what are you going to do to take vaccinations to communities? Will you have more pop-up sites and mobile vaccination sites, and how will they work?
Morning, Mia. Morning, Ayanda, and the viewers. Yeah, I think that you're absolutely right. We need to understand where people are and what they do during their days. So if people are going to shopping malls, then we need to make sure that there's a place at a shopping mall, and that's what you're talking about, a pop-up. So it's literally a tent or a gazebo type arrangement where on that particular day, vaccinators will come from the fixed sites and provide vaccinations to people at that site. The same thing can happen at taxi ranks, in people's places of work. Many employers are coming to us and saying, can't you just come to our place of work and vaccinate people at that place of work? So, and then at universities, TVET colleges, other sort of institutions of higher learning that are available, any of them. The idea is that we'll take the vaccinators from the fixed vaccination sites as far as is possible and move them from one place to the other so that it's easier and quicker for people to get vaccinated at those places.
So on Friday, the Health Minister said that you will also try and get transport for people in high-density areas to be transported to mass vaccination sites. And he mentioned an example, for instance, of people in Alexandra who will be transported to a mass vaccination site in Gallagher Estate. How often will this happen, and how will they be transported?
Yeah, so this is quite an exciting thing, but it's quite a lot of logistics organization, and it's not the core business of the health department to do it. So we want to be careful. There's a pilot project starting on Tuesday at 5 big sites around the country where there will be shuttle buses. For instance, in the Western Cape, they have a thing called red dot taxis. I think the community there is very familiar with these red dot taxis, which commute people backwards and forwards to various places in the health service. Those red dot taxis in the Western Cape are going to be assisting to get people to the CTICC and down in the city, but also to Athlone Stadium. So 2 big pilot sites there. And then, as you've mentioned, there are a couple of pilot sites in Gauteng. We'll run that shuttle bus and shuttle taxi service together with various operators for a period of about a week to see what we can learn from it, and the pickup points to try and establish exactly where those pickup points are, that people are familiar. And then from whatever we learn from that, we can start to make announcements and roll them out to even more sites.
Dr. Crisp, we know from research that if we increase people's trust in vaccines, they're also more likely to get vaccinated. But for this, we need well-designed communication campaigns, and up until now, we haven't seen enough of this from the health department. So are you planning to improve on this?
Yeah. Thanks, Mia. Yeah, so what we've seen is people learn and get information from a lot of different places. And in the beginning, as we rolled out, it was more formal communication that was taking place on the newspaper, in the newspaper, on the TVs, sometimes radio stations. So now what's happened is a large number of communication mediums have come to us, radio stations, community radio stations, national both radio and TV stations, and have said, we would like to participate. We want to communicate. Can you help us with this messaging so that we are clear that we are communicating facts? So the past week or so has been a very concerted effort to bring everybody on board, provide the material, provide the necessary details of what it is that people are asking us that they want to know. And we should see a lot more in that space. And then on the print media space, a lot of people have asked us, they are prepared to put little notes in with grocery packages, with food parcels and so forth, and can we help them with the messaging? So I'm hoping we're going to see a lot more of this rolling out in the next week or 2.
That was Dr. Nicholas Crisp. He is the Health Department's Deputy Director General in charge of our vaccination rollout, and he was talking about the government's plans to get more people to take up jabs.
I guess on the back of that, Mia, this is a clear, indication, reminder, for lack of a better term, that it really is a multi-stakeholder approach in trying to ensure that we get as many jabs into people's arms. The question I imagine many people watching might still be thinking, though, is, are we not a bit late?
That's a fair question to ask because we're clearly behind on targets, but we can never say too late is too late.
Right.
We must always try and do this. And the two things we should really do, you know, in studies, they have 3 C's that they mention. It's complacency. You must make sure that people know they have a risk of COVID. You must make it convenient, so you must make it easy to get vaccinated. And then you should also build confidence in vaccines. And that is what we're really hoping the health department would start to do a bit better.